Well, now I feel like I really have to bring the A game. So I'll review the data in the context of the discussion that will then follow. And if members of the board have questions about the data, I think this is probably familiar in general, but if there's specific questions, please feel free to interrupt at any time. So in terms of background, when we look at the case rates for Dover and Sherborn, what we've done since the start of last school year was create a combined metric that treated the two towns as a single entity, since we've got intercalation at the middle school and high school level. And so this first graph represents the average daily case rate of that combined community unit using the weekly city town data that's released by the state and comparing the case counts for the current report period to that 2 weeks prior and treating differences in those counts as representing the number of new cases. This is partly because for small towns like ours,
I think
Aaron, can you please?
Yes, the people who just joined may also be affecting that.
I also see some other people who aren't muted. Just if you could stay muted unless you're speaking, that would be great.
And so this case rate is sort of inferring the difference between two case counts is the number of new cases. This is partly because for small towns like ours, the state doesn't release case counts less than 5. And so you could have 2 new cases, but it would just say less than 5 in terms of the weekly report. So there's some limitations in that data, but I think it's consistent with what we've done since we reopened school in the pandemic. And this tracks the trend from June 3rd of last school year through last week's data. This data is updated weekly, Thursdays at approximately 5 p.m. And so what we see is that we saw a summer uptick. We've seen a general downtrend since about mid-September with kind of ups and downs, but a general downward trend with the lowest values on November 4th. I don't include the positivity rate here in part because throughout, Dover and Sherborn have had robust access to testing and have consistently had levels of COVID positivity that were on the low end of the spectrum. And so focusing tonight on the case rate is the part that is most likely to dynamically change for us. The second table is a view of the raw case count as listed in that same report for the two towns extending back to May. So this is from May 20th to November 4th, showing the cumulative case counts between the two towns. The last slide is the average daily case rate as reported by the state for the municipality. This will tend to be somewhat different than the combined metric we've used, partly because the denominator for the population may be different in terms of what we've used consistently throughout the dashboard period and what the state did since they released their data in this fashion after we'd started our dashboard, and partly because they may have more granular individual level data that we don't have as public reports. And so in general, these will be pretty close to concordant, but may occasionally be off a little bit. And so what we see here is that, comparing Dover in gray, Sherborn in, I think it's orange, but I'm not great at my oranges and reds, and the state in blue, we see that in general, in the kind of winter and spring, Dover and Sherborn tended to run below the state. In the more recent surge since the summer, we've tended to be a little bit more concordant with the state, with a little bit of separation in the last couple of weeks. So that's kind of the background in terms of the case rate data. I think that one of the things that has been considered in looking at the prudence of indoor masking mandates is concordance with the CDC's recommendation for indoor masking in those communities where COVID incident rates are above a certain threshold. Translating that to this data, they do a slightly different data, which is the weekly case rate, and they use a cutoff of 49.9 is the threshold for moderate, 50 is substantial transmission, and the recommendation right now is for substantial transmission to recommend universal indoor masking. The other piece that I'll share for background here, I think this has been discussed in more detail in the joint school committees previously, is that the current mask mandate under which we're operating is sort of coming from the state at the current time. I think that what we would produce tonight would be guidance to the school committees to, allow them to then consider kind of their next steps. And the current situation is really limited to the high school. So the state's requirement for masking requires that 80% of a school building community be vaccinated before they may be considered eligible for the off-ramp. So for the middle school and elementary school, we haven't hit that threshold since there are kids who are too young to be vaccinated prior to earlier this month. The only school community that we have that would be potentially eligible is the high school. And in that school community, we have a rate that's about 89 to 90%. That's in excess of the state's minimum requirement of 80%. And so that's allowed us to attest to the state to say, we've made the 80%. I don't think the outcome from tonight is that we'll be immediately unmasked in school. I think this is sort of a series of pieces. I think the first piece is the state allowing the district to regain some local control upon meeting that 80% attested threshold. It's then for us to give some guidance tonight to the school committees, and then it's ultimately up to the school committees to make that determination and to the district to have time to appropriately communicate and outreach to families and work with kind of other stakeholders. So I think for us tonight, it's really just to say, what's our guidance to those various groups, as opposed to, this will immediately change practice tomorrow. So let me kind of pause there. I'll invite Kay and Matt for any other comments or any other questions from other board members, or if there are things that you put differently or that I omitted.
I think that was well described, Matt. I think that just to sort of highlight a couple points, the district did request a waiver to allow us to remove the mask mandate, and I think we're just waiting to hear back. So we anticipate that that'll be granted. It just wasn't as of yesterday. And then I believe that based on the MOU with the teachers, they have to sort of meet with them again prior to changing this. And so those are some of the pieces that have to sort of happen mechanistically and logistically after we vote. So I think, we would make like Matt said, we would make a recommendation tonight and then leave it to the school to implement once they've sort of checked all those boxes. But I think otherwise, that's very clear. I think, for me, I've always sort of looked at when we are below the sort of CDC recommendation, which is 50 total cases per 100,000 over a week, which translates to I think a little more than 7 for a daily rate by our metric. Then it seems reasonable to move ahead. Okay, was there anything you wanted to add?
No, you addressed what I was thinking, so I think I'm all set.
And I would say I like the idea of being flexible where we can be flexible. I like that there's another layer that the school is going to be reviewing it to within their community, really kind of a more isolated community. But I think as some of the graphs that Matt has shown is that it's like a roller coaster, this pattern of, things are going well and then things ease up and then cases rise. And so anyway, but maybe we can stay low despite removal of masks.
And I think that's a great point, Dale. And I think, one of the things as we talk about, I think there's, again, kind of going back to the guiding principles about I think being clear and explicit about what's our most important things and sort of how does that sequence. I think first and foremost, having a safe school community for all attendees is our kind of have to achieve that. I think having in-person school is a close second, as a very high priority. And one of the things that as we consider how we navigate risk and how we navigate this phase of the pandemic makes a lot of sense. And then I think the last piece is to figure out, what's our next step as this continues to evolve, and how do we engage in that next step in a thoughtful way that provides as much normalcy as is compatible with the first two goals. I think that normalcy at the cost of in-person school or normalcy at the cost of safe school isn't the right strategy, because I think that, you know, you can see that get rapidly disrupted. I think in Boston this week, Curley School, which is one of the JP elementary schools, need to go all remote because they had a number of cases in the school. And so as we balance that, I think that's one of the things for us to collectively keep in mind. My own opinion is I think we can do those things in a way that balances those risks thoughtfully. But I think it's also important to say out loud, like, these are most important things as we make choices.
Matt, you remind me that it might be worth just reviewing the number of cases in the school this school year thus far. I don't know if you have that.
I don't have that number. I think what I would say is I think it's a little bit harder to infer for the high school. I think one of the things that's been really nice at the elementary school is that we've had pretty robust uptake of pooled testing, which I think gives us a pretty good finger on the pulse. And I think, you know, my opinion is that data also supports these being kind of reasonable next steps for us to consider.
Right, and the other thing I'd like to add is I know we're looking at focusing on community data, or the two communities, but we're not isolated from the rest of the state. So I'd also like to keep an eye on what's going on in general around us, because we're all moving in and out of our two towns. We're not limited to there. So
I 100% agree, Joe. I mean, I think understanding the trend data and understanding, you know, again, as we are much more fluid as kind of Metro West communities coming into Boston, having more people come back to work, like, all of these things are not in isolation, and the patterns that we see at the local level, you know, don't tell us, they tell us as much as they tell us, but they don't tell us more than that. So I think it's helpful to know. And if we saw really high local case rates, I'd say, boy, that should give you caution under all the circumstances. I think seeing low is reassuring, but it doesn't say, hey, there's nothing to worry about or think about. But, you know, I'll take low over high any day of the week.
Hey, Matt, I just want to confirm something. I think you talked about this a couple meetings ago. So that 89-90% high school vaccination rate, that's including both students and staff, correct?
Yes, staff is higher than students given the vaccine requirement.
Right.
I think my recollection is that students were in the mid to high 80s, and that staff were at 98 or 99% at the last point that I sort of heard about the data. But again, we sort of have two different sets of rules right now. One is a staff mandatory vaccination, and one is a sort of voluntary uptake we've seen at the high school.
Right, but yeah, I think you said it was like close to 98 or 99% for the staff. So
yeah, so I mean, I think what we've seen locally, and we'll talk about some of this more for the municipal data, is I think in both Dover and Sherborn, we've seen pretty robust uptake across demographics and age groups. I think we'll continue to see some variation there, but it's been very robust. Are there other comments or questions that folks want to raise or address?
I think somebody just posted something in the chat, but I turned off chat because I really do want people to be participating in the discussions, and it's a lot easier for everyone to keep up with it if people just raise their hand and speak.
What I would say, Daryl, is like our period of comment is closed. And so I would say we sort of had that window and for us to just proceed. So if there are no other comments for the board, I'm happy to share some draft language that I prepared in advance of this, just to sort of start as a working point, and that we can collectively edit and endorse if we're so inclined. Does that sound okay?
Yes.
Sure.
Yep.
All right. That now Zoom's helping my wellness, so that'll be really good. Perfect. Can folks see the Word document, and is it magnified adequately?
No,
No.
we still have the PowerPoint.
Yeah, we're still at the graph.
All right, let me try to stop share and reshare. I think that's a town building one. All right, I'm moderately confident. About now.
That looks good.
Yep.
And so this is very much a draft, but I just wanted to kind of have a starting point so we weren't kind of all operating in a void. And so I'm going to go through this for folks who can't see it very well, but for those on the screen, let me know. And what I'd favor us doing is kind of editing in real time to arrive at something that feels comfortable. So given high rates of COVID vaccination at Dover Sherborn High School and current efficacy of the COVID vaccine, it is reasonable to consider lifting portions of the indoor mask requirement implemented August 19th under the following circumstances. Unvaccinated students and staff are required to remain masked per DESI mask requirement of October 26, 2021, unless they qualify for exemptions delineated in that guidance. So pausing at this bullet point, this is part of the current active state requirement, and we're not in a, like, we don't get to decide. This is from DESI, and so we are the implementers here. Case rates should remain below those rates described by the CDC criteria recommending universal indoor masking based on the results of 2 consecutive weeks of reporting data using the Massachusetts COVID Dashboard Weekly City-Town Report. Specific scenarios may modify this process if concerns arise regarding elevated risk of in-school spread related to specific patterns of exposure and infection. So for this one, we are using 2 weeks of reports, which constitutes 3 weeks of data from that report with how it's compiled. It's a 2-week span that we're sort of incorporating in the fashion that we're currently reporting it out. To Matt's earlier point, this is slightly above 7 cases as their case rate. So we're 1.6 last week. That number staying less than approximately 7 is the current requirement. Should CDC guidance change or other sort of regulatory guidance change, this certainly may need to change as well. And then the last bullet, by federal public health order, all students and staff are required to wear masks on school buses. Again, this is from the DESI document and is not something that we sort of have a role on, but to make sure it's clear. I think that one of the points that was raised when we talked about masking at the beginning of the school year is, you know, families that felt understandably frustrated as that hadn't matched the expectations they had for what they thought school would look like. And I think it's important as we do this step to recognize there may be circumstances where we need to put masks back on. So reintroduction of masking may be necessary and prudent in future scenarios, with some examples including, but not limited to, the following. So if we have evidence of elevated risk of in-school spread related to specific exposures within school or community at large, a substantial rise in local or regional incidence of infection, or the emergence of new variants that are either substantially more transmissible or substantially more likely to cause severe disease, including hospitalization and death. So my hope is that we remain in a position that we don't need to do it and we don't need to remask in the high school, but it's certainly possible that we could. And I think it's important to communicate that, you know, this is a step that's, you know, maybe reasonable for us to take right now. And there could be changes in circumstances in the future that would require us to take another approach. So let me sort of pause there and invite folks if there's language that you change or things that you add or remove.
Actually, I was thinking I like a lot of the things that are in here, including the subject to specific patterns of exposure and infection. So that certainly captures the concept of there can be something that takes place that we never would have predicted, and yet it raises concerns, and therefore we may address that. So in general, I like what it says.
And Steve, what are your thoughts?
I have a suggestion on a grammatical correction in line 2.
I would welcome that vigorously. Fire away.
It reads, "It is be reasonable to consider." How about striking the "be"?
That sounds delightful. What else you got?
That's all I've got.
I'm doing pretty good.
Yep.
Kay and Matt, what are your thoughts?
I'm pleased with the flexibility that it allows, but also with the structure of linking to the CDC guidance in general. And I think that that's a reasonable guidance. those numbers. And we may see some change in them, but having the language be not having the language be non-specific enough that it allows for that change without us having to revise the document each time there's a change in the CDC guidance is a good idea.
Sounds good. Matt, what are your thoughts?
Yeah, I don't really have a lot to add. I think this is sort of a good balance between communicating what we're basing this on, but remaining flexible in the face of potentially changing guidance from above us and situations that we may not have anticipated. So I'm pretty happy with this.
That sounds good. Rebecca, what are your thoughts?
I have a thought, Matt.
Oh, perfect. So Lisa, why don't you fire? Oh, yep. Lisa, why don't you go first, and then Rebecca, if you have anything to add.
Did you when I spoke?
No, we didn't.
Oh, I'm so sorry. I was saying thanks for all your work. Sounds good. I don't have anything to add.
Perfect. Thanks, Rebecca. All right,
Sorry
Lisa.
about-
fire away.
I also think this is a nice balance, but my only question as a science nerd is when it says substantial rise, there's not really a parameters set to define that. So I guess, is that going to be up to us, or is that going to be?
I think so. I mean, so I'll share what I was thinking about with that language, but I would welcome feedback from kind of anybody. I think one of the things we saw as we looked at particularly the reopening phase of last year is that it got really easy to get very anchored to specific numbers about this is where we're at. And I think our experience has been, particularly as small towns, like one case changes at 0.8 points. And so trying to stay flexible about saying, I think 7 is, or around 7 is a reasonable point to come off. I think that how we'd want to couple things is a little bit hard to predict. I don't think it's the intent to say, oh, it's 8, so we're back on. I think it's really to say, is there a clear and concerning signal? And I would expect it to come back to a kind of public meeting of the boards to say, hey, we need to talk about this, and kind of collectively answer that gut check of sort of what substantial looks like. I think I wanted to preserve some flexibility so it wasn't, it's 11 and we're like, well, it's 11, but that was like a large family is a bunch of those cases. And is that a different risk profile than, a bunch of isolated cases or kind of whatever that threshold is. So I wanted to provide some flexibility there and signal that it wasn't a sort of minor rise or a sort of arbitrary cut point of like, this is a threshold where we have to remask. Does that seem reasonable?
Also,
Yeah, I mean, I think that makes sense. I'm just picking apart the things that, I, as a scientist, I get picked apart.
It's totally.
in my language.
No, I think this is one where this is like an intentional hedging, because
Yeah.
I think I do want to kind of stay flexible and thoughtful, but I think you correctly detected the total hedge there, because I don't know for sure what the right number is, and that could also change over time.
Okay, I agree with that, and I appreciate that. And I guess my only other caveat is, if there was, for example, a family went on a trip and a large family, let's say there were like 6 people in that family and they all became positive for COVID, and it caused a rise, but let's say none of those people were in the schools. So, I
think that's a perfect example where
exactly right.
Yeah.
So I just think it is important to keep that flexibility. I'm agreeing with you. I was just playing devil's advocate.
No, I think that's I both appreciate that. I think that's a perfect example. And I think there's also the flip side where we could say, hey, there is a large barn party and we've got cases transmitting there. And some of those kids are not from town, but we know that 5 kids have COVID. They just don't happen to live in Dover and Sherborn, but they're at the same party. That might be a time that we'd say, hey, there's a particular pattern of spread or risk right now that we may need to take a different strategy for. Again, I don't expect that to happen, but want to be transparent that like we have to go back to what are our most important things. And so if we have concerns about uncontrolled spread related to a specific pattern of risk or a specific incident, that, for example, could be a reasonable time to say we need to look at a different strategy for a week or two while the dust settles and while we figure out what makes sense. And then again, I think we sort of had a knowledge and experience with COVID, and then we had Delta, and it's really changed the sort of performance characteristics. And my hope is that we don't have anything that's much more disruptive than Delta has been, but it's certainly possible.
The other thing I want to note about substantial is, and you kind of touch upon this with the family, large family not in school and the barn party with a lot of kids, are just other settings, like whether it's sports or performances or intertown beyond Dover Sherborn borders events, that substantial would have a different meeting in all of those settings.
So if folks feel comfortable with the language without further edits, do we want to sort of proceed with voting on this, and then maybe we can talk about municipal buildings and kind of go from there?
Okay.
Uh,
So I move that we adopt the language as presented on the screen here.
Second that.
Okay, so, and we will have roll call vote. Daryl, aye.
Matt Beavers, aye.
Lisa, I.
Rebecca Honeywell, aye.
Matt Vitale, aye.
And Dover, if you'd like to vote.
No, we need a motion first.
Ah, yes.
I move that we adopt the language on the screen.
I second.
All in favor?
I, Kay Peterson.
I, Stephen Kruskoff.
Perfect. Thanks, folks. And so for next steps, we'll then share this with the district, and then it'll sort of be the next step in the process, and we'll kind of go from there. So for the purposes of the data review, we'll get the next data update tomorrow with the release of the state data. Again, my hope is that will remain less than 7. I think that kind of implementation will then depend on the host of factors that Matt alluded to before, but we're kind of, you know, on our step of the process en route. So I'm happy to review that data and circle back with the school as we kind of get it back tomorrow and see where the numbers are. So with that, I'm going to stop sharing this one. And I know for Sherborn, I think one of our goals is to also talk about municipal buildings tonight. I don't know that we have to arrive at totally the same language there, since it's sort of separate. And so I guess Kay and Steve, do you want to stay on for that, since that doesn't require sort of concordant votes, or do you want to sort of, how would you like to proceed? We're certainly happy to have you, but don't want you to feel, I've got draft language that I think is delightful, but you may arrive at something different. And since the schools versus the kind of municipal or town requirements are different, I don't know that we have to get consensus on that. So what do you think makes sense?
Well, I would like to stay and listen and participate.
Perfect. That
Steve,
sounds,
how about you?
I would like to stay and participate, but not call for a vote for Dover at this point.
okay. I think that no objections here. And so for the purposes of review, we had reviewed the municipal data in that last graph. And so I'm just going to share my screen with draft language that I put together for town, which is slightly different. And I'm much less worried about barn parties. And so for this, what I adopted was, oh, actually, let me share one other data set just because I pulled it up and I think it's pertinent though limited. Can folks see the weekly COVID municipal report on the screen now? And is it adequately magnified?
A little bigger would be nice.
So this data is again from the state. I think the state data has been helpful, but all of it has some set of limitations. So this is one of their tables filtered for Sherborn and Dover. I have pulled out the partially vaccinated data and kind of just focused on this subset. So I've hidden some columns here. So this is a subset of the data one would see from that report. I think one of the important limitations here is that the D column for population is kind of an actuarial arrived at number that uses historical census data and a particular calculation to say, this is how many people you have, but may not perfectly align with how many people we actually have, which can result if we consider row 1595, for example, the population in D is listed as 280, and the number of known vaccinated individuals is 294. So this is not voting in Chicago back in the day. It's because it's a sort of actuarial calculation for the denominator for the total population, and the numerator is actually specific individual data from the state vaccination database. So I think that the counts in column I are correct, though they clearly will overestimate because the actuarial model for how large specific populations are may not be perfect. And so if we had a community with low general rates of vaccination, then you wouldn't see that as visibly as we do. We see it because we have very high adoption. So highlighted here for the total population of Sherborn, it's 87% vaccinated. For Dover, it's 86% vaccinated. I think that one point worth noting is that that vaccination rate is of the total population, not of those eligible. And so I think it, again, using something like greater than 95% is reasonable. And so as we discuss kind of municipal practices, it's within a framework of assuming that Sherborn is not in fact 99.3% vaccinated and Dover is not in fact 100% vaccinated, but it's likely quite high, somewhere in the mid-90s with those limitations. So with that, I'm going to stop sharing this screen and I'm going to share the draft language, and again would welcome edits, grammatical corrections, in general betterment.
Matt, are these vaccination rates going to be updated henceforth on some kind of periodic basis, since now 5 to 11-year-old cohort is eligible?
I assume so. The last data update from the state for that, I think, was before the FDA, before the approvals for the 5 to 11. So I assume they will add a 5 to 11 row as well. And that will then sort of see that and be able to track it. Again, I think it will be helpful to give us kind of broad direction, but I would think of it as like kind of plus or minus 5%. But I think directionally clear. And again, I don't know the details of their population modeling, but I would say it's probably a reasonable strategy to compare like towns to say, hey, if this is where we're at, this is where Hopkinton or Ashland is at, those are probably relatively comparable. Am I successfully sharing the draft language again?
Yes, I just have a question on the vaccination of the under 12. And
Sure.
I've heard anecdotally that it's not so easy to get appointments. I don't know, are you hearing similar, or is that
So what I would
not
say
so
is,
widespread?
I will give my 2 cents, as well as my sort of parent of 2 children under the age of 12 experience. I think because the vial composition is slightly different in terms of what the dose is in the vial, you can't piggyback on all the existing adult vaccine that's out there. It has to be distributed as the under 12 set. And so I think that the access is still much, much, much better than it was for most of the opening phases of adult, but there is still more desire for kind of access in Massachusetts than there is in vaccine. So I think that CVS has been booking up fairly quickly. I think that clinical sites and pediatricians' offices have been booking fairly quickly, but it still doesn't feel like those kind of earliest phases when the general adult vaccine rollout came out and you sort of, there's like nowhere anywhere in Massachusetts to get a vaccine. I think, you may not have time slots that is desirable and you may not have the first choice of dates, but I think people are able to find it, though not necessarily in ways that are super duper easy. But I think in general, right now there's more enthusiasm than access, but access isn't terrible. Matt and Kate, does that kind of line up with your impression as well?
I think the main point is that access is more limited by vaccine availability than provider availability at this point. I will also add that the schools put themselves on the list for a mobile clinic from the state. Who knows where we are on that list or how long that'll take. But if we get to a place where a vaccine availability ceases to be the limiting factor, and it's more a question of being able to find an appointment, that we're in line to get help on that. I would not be surprised if by the time we come out of that line, everyone who wants one has gotten one, but it doesn't hurt to try.
It's a good backup plan.
Yeah.
My sense is that the municipal vaccine clinics and school-based vaccine clinics that are being held are filling up immediately, are very popular.
Yeah, that's what I've heard as well. I have a colleague in Arlington, and they said within an hour, all 1,800 spots for the school clinic were full. So there's I think more demand than doses right now, but hopefully that'll get better.
Perfect. So I think folks can see my screen. Again, I'll walk through it similarly, but it's a bit shorter. So given high rates of vaccination in Sherborn and current efficacy of the COVID vaccine, we will hereby lift the mask mandate applied to Sherborn municipal buildings voted on September 1st, 2021, when the following conditions are met. Case rates should remain below those described by the CDC criteria recommending universal indoor masking based on the results of 2 consecutive weeks. So this language is essentially the same, and the threshold is the same as that which we adopted for school. Similarly, reintroduction of masking may be necessary and prudent in future scenarios, with some examples including not limited to the following. Again, no barn party in this scenario, but substantial rise in local or regional incidence of infection, emergence of new variants that are either substantially more transmissible or substantially more likely to cause severe disease, including hospitalization, death, or patterns of spread suggesting a reasonable possibility of ongoing uncontrolled spread within municipal building or buildings. And so in that scenario, I'm thinking about a little bit like if we had some level of concern that, not unlike school, there's a specific pattern of transmission or risk. I think part of what gets hard for the municipal building is if a town worker, for example, doesn't live in Sherborn, then there's no specific notification that we would get that pattern was happening. It would go through their local board of health or a local contact tracing process. But again, I think to kind of give the caveat to say, not unlike school, if we have a period of time where we have a concern for the possibility of uncontrolled spread between occupants of a shared space, a period of masking is a good strategy to mitigate the risk of secondary transmission. Again, I don't anticipate that we're going to see that, but just to highlight to folks, I'm hopeful that this will be our kind of unmasked and able to stay unmasked, but I've hoped that before. So wanting to acknowledge some example scenarios. So let me pause there. Fire away, Lisa.
Okay, grammar police again.
So
So
appreciate it. Fire away.
so we should put probably a colon at met, not a period, and also a colon at after following, and then below for the following colon, and then between you should put like a semicolon after infection. You should put a semicolon. No, so substantial rise in local or regional incidence of infection, semicolon, and then add a semicolon after death, and then no, stay there. And you probably want to do a slash and or comma, right? Because it's if any one of those happens. Okay.
I'll take all the help I can get.
And then you could probably do a period at the end of buildings, municipal buildings at the very end. Yeah.
I hate semicolons, but I'll set that aside for now, Lisa.
Okay. It's
I'm
a
a
little
semicolon
awkward.
fan, so
I'm
they're
apparently
more distinctive thoughts. Oh. So I guess, was I thinking, feel like we have a little bit of a different situation from even what businesses are doing, where they know who's vaccinated, who's not, can enforce things differently. We don't have that gradation here. So there are two things. One would be informal, and I don't know that we could really capture it in writing. One is somehow I'd like us to have a community within town hall that does not treat people oddly if they choose to wear a mask. And that has been going on. So it'd be nice if that stopped. And then the other piece would be I'd advocate that the town services still provide things remotely if possible for people who are uncomfortable coming into a building where people are unmasked.
So what I might suggest is, I think that's probably separate from the mask mandate, but I think important considerations to communicate. And I think kind of, you know, one of the things that I think for school too is really important is, just because we say that this may be a reasonable thing to take as a school community, it may not be a reasonable choice for each individual in terms of their own kind of personal comfort zone, family comfort zone, other pieces in terms of choosing to remain masked, and creating expectations that that's sort of permitted in general, I think makes a lot of sense. And I think the 2 points you raised, Daryl, make a whole lot of sense. That again, I think, you know, continuing to offer and accommodate Zooms, like I'm glad and hopeful that we can take this step. And I personally believe it's a reasonable one. I also think the degree to which we can continue to conduct business reasonably with a Zoom both promotes community access compared to our historical attendance, and I think makes access in general more accessible to folks who may not yet be comfortable doing that. So I would certainly continue to support that. I would probably uncouple it from the mask mandate. But I do think wholeheartedly endorse as I think separate pieces of guidance to communicate to the town administrator and I guess the select board.
Do we know? Oh, sorry, Daryl, I have a question. Does the town employ more than 100 people?
I don't believe so.
If we don't
So-
count teachers.
I think teachers are excluded, is my recollection, for how it applied to any of the federal guidance.
That's
And
what
I
that's what I was wondering.
I think municipalities are as well, but I'm not sure.
I
I
presume.
think that's right.
I'm wondering though, if we could include, I could see how people behave towards one another is something you can't really codify so readily, but having something in, if it would be easier for folks if this was joined together with guidance saying, and to help support or to support people who can't come in to continue with remote services, somehow couple it with this. I had in mind a sentence for that, but I've lost that. So if I come up with that again, I'll bring it up.
And I think if we sort of, again, I think these are appealing steps, but especially if we're doing this kind of on the Sherborn level, like we'll have our next Board of Health meeting next week and can also say, you know, like for me, this passes like a check of something I feel comfortable with. I would also be enthusiastic to add the specific two-part guidance you want as language and kind of a memo that we prepare as a board to the town and to the boards of the town. But I wonder if we could do that at the next kind of regular meeting in terms of that memo guidance.
Okay, I'd be okay with that.
Because that lets us kind of press that piece of language, which I think you're right is really important. And again, I know there's differences of opinion, but for our family, it's certainly much easier to attend and participate when there's sort of remote access that we can kind of integrate when we're an attendee or audience member. And certainly that flexibility has been really appealing. And I think certainly for our board makes a lot of the technical data more accessible and easier to see and share.
And we're reducing fuel use and air pollution.
Well, I mean, I do all these Zooms from my car, so I'm not totally sure, but
Oh,
it's the only way we get peace and quiet around here. So I guess if folks feel comfortable with this, I think, you know, we can sort of vote on this language as conditional to the case data that comes back tomorrow. And again, I'm happy to then circulate that, follow that data up and share it with Ellen as it comes in.
I would, since we do share a school system, I don't know if the Dover Board of Health has any comments on this, given that we're both feeding populations into the schools.
I'm not sure I understand your question, Daryl. You mean,
Well, if,
Does this seem terrible to you?
yeah, that would be the direct way to ask it.
well, how is it related to the schools? That's what I didn't
Oh,
understand.
no, just that if it promotes more spread in our town and that
Oh, I see.
rises, then
Yeah,
we'll have
I
to,
understand.
you know, do something. But if you're continuing mask mandates in Dover, then we're not on the same playing field.
No, I'm actually quite comfortable with this for Dover, related to the municipal mask mandate. I don't know about you, Steve, and we're not, I don't think we're prepared to vote on it, but
Mhm.
Well, I don't think we advertised in the agenda that
Yeah.
our
No,
discussion would include this.
right.
Yeah.
And I think we'd like to have Jerry involved in the discussion as well, but I just, in general, I'm comfortable with the concept, and I think the alignment with the school, the school guidance is a nice feature.
I might mention there's still strong support in Dover for masking indoors in public buildings.
Yeah. And again, I don't think, you know, for me, I think this is a place where thoughtful people could arrive at different conclusions and like, you know, and kind of tailoring that to the local community makes a lot of sense. On the Sherborn side, do we feel comfortable with a vote on this or any further edits, colons, semicolons, hyphens, or parentheticals? Parentheticals I'm enthusiastic about. Semicolons I'm plus minus.
Noted.
So
I think I'm comfortable if others on Sherborn are.
Yeah, I'd be
feel
comfortable.
free to vote.
Mhm. All right, so I'll make a motion that we vote to approve this new mandate.
I'll second that.
Any other comments? Daryl, I.
Matt Beaver's eye.
Lisa, I.
Rebecca Honeywell, I.
Matt Vitale, aye. And so as next steps, I will follow up the data tomorrow when it comes in, and we'll circulate it to Ellen and to Daryl with Town Hall. Is Town Hall open for Veterans Day, Ellen?
No, it is not.
So I think then that, and then Town Hall is closed on Friday, is that right?
It's open part of the day.
Okay, so I'll circulate the data to you, recognizing that sort of implementation updating may end up taking until next week with the holiday tomorrow. But either way, I'll provide the data to you about kind of where we landed.
Okay. So we've discussed the things that were on the agenda. So would we like to take a roll call vote for adjourning the meeting?
So moved.
Do we have a second?
Second,
Seconded.
All right, Daryl, I.
Matt Beaver's eye.
Lisa, I.
Ditto for Dover.
Aye.
Second, aye.
Oh, Rebecca, did you say aye? And Matt, did you get to
Aye.
vote?
Yes.
Okay.
And Matt Vitale, aye. And with
Okay.
that, I'll have a fabulous night.
All right, everybody.
All right. Thank
Bye.
you.
Thanks.
Good night,
Bye,
everyone.
everyone. Bye.
Thanks.